Welcome to the OIS podcast. Today, we have not one, but three eye care leaders, all of them part of Orbis International, a global nonprofit that's been fighting avoidable blindness for over 40 years. They've trained doctors in countries from Asia to Zambia and helped millions of people see clearly. Welcome Hunter Cherwek, Gabriella Lanuette, and Sophia Patai, who also joins OIS as our newest podcast host. Rob Rothman, let's kick this off.
Hello, OIS podcast audience. Happy to be speaking with you again. My name is Rob Rothman. I am no longer introducing myself, as hopefully everybody knows who I am at this point. But just for a few seconds, I am a clinically practicing ophthalmologist, and I also run a venture capital fund called In Focus Capital Partners that invests solely in ophthalmic drugs, devices, and technology. I have the unique privilege today of speaking with some very important people in ophthalmology who are participants inside of Orbis International. And I don't know if everybody who listens to the podcast is aware of Orbis, but hopefully you'll have a much better understanding of what Orbis is and who they are after this discussion. But suffice it to say, from the minute that I entered the world of ophthalmology, I was exposed to Orbis and what it does and who they are. And unfortunately, this is the first time I've been able to interact with the organization at an intimate level. Today, we have Dr. Hunter Cherwek, who is the VP of Clinical Services for Orbis. We have Gabriella Lanuette, who is a machine learning engineer, who will be talking to us about some of the incredible new initiatives inside of Orbis, and Sophia Patai, who I've had the privilege of knowing since the very beginning of her career, who is also an ophthalmologist, a former participant in Orbis clinical initiatives, and is now a trustee of the board of Orbis UK. So a very diverse group of people. Thank you all for taking the time to be here today and for giving us a little bit of an exposure to Orbis, who you are and how you've grown and morphed over the years. I think it makes most sense for us to start with just a little self-introduction. So Hunter, maybe you want to go first, tell everybody who you are and how you got to Orbis, and then we'll talk a little bit more about the organization itself.
Yeah, thanks, Rob. So my name's Hunter Cherwek. I'm an ophthalmologist. I trained at Emory. The day I graduated, I turned in my pager when that was a thing. And 48 hours later, I was in Western China on the Orbis Flying Eye Hospital. For those who don't know, Orbis, you can go to our website, orbis.org, orbis.org, is a global nonprofit that focuses on avoidable blindness. We really, kind of like you, focus on technologies and training, whether that's our Flying Eye Hospital or the Cybersight website that I know Gabriella is going to talk about. So it's a really exciting organization. We're all around the world through Cybersight now. We're in every country in the world except for two. So it's very exciting to see the global footprint we have and the impact we're having through technology and training.
So just before we jump off, and I want to stay on your bio. So I was a resident ophthalmologist just like you. The 2 days after I finished my training, I turned in my pager and picked up a new pager. So, obviously something led you to believe that this was going to be a mission for you. And how does that exposure occur? Because I don't know that, I think every clinical ophthalmologist on the planet probably knows Orbis, but I don't know that any non-ophthalmologist or that many non-ophthalmologists are familiar with the organization. So how did that happen?
Yeah, it's a great question. So I went into medical school knowing that I was going to do global health. I was fortunate enough to spend a lot of time in Kenya and East Africa as an undergrad, did some amazing work with different NGOs, and was really excited when I did my residency because I was getting all these skills in ophthalmology, saw the impact that vision health and giving someone their sight back had. But I really wanted to focus on something that was more skills transfer and capacity building, not service delivery. I also wanted a non-denominational organization and really wanted something that was working hand in hand with local communities and working with some of the best professors. The really cool thing at Orbis, we have over 400 volunteer faculty who are kind of the who's who of ophthalmology from over 30 countries. So I can sit down at a dinner after a very long day in the clinic or on the Flying Eye Hospital and literally talk with thought leaders from not just retina or cornea or glaucoma, but also from Sri Lanka, from the Middle East, and from Canada. So it really has been an incredible education for me. I would tell you that I'm kind of on a 20-year fellowship through global ophthalmology. And I've been learning a ton from the new technologies that are just pouring into ophthalmology. I mean, we're the first field of medicine to have FDA approval for gene therapy and autonomous AI, and Orbis is actively involved in both. And that's why I'm so excited to work with Cybersight and get genetic consults from the Middle East and learn all these new genes and things that were more sci than fi when I was going through residency, but now is definitely science. And Gabriella's a huge part of that team where we're doing artificial intelligence, trials, randomized clinical trials in Rwanda, doing incredible work in Vietnam. And so it's just, for me, a constant state of learning.
I'm a little jealous. Obviously you realized there was a way to have a global impact, when you were in your late 20s, and it took me until I was in my late 40s to figure out there was a way to do it through investing. So, kudos to you, and thanks for making me feel a little stupid, but it's fine. I know you didn't mean it. Don't worry. I'll get over it. Anyway, before obviously we have a lot more to discuss, but Gabriella, why don't you tell everybody about yourself and how you got involved? And then, we're going to get back to everything that you do, but just a little bit about your history and how you ended up at Orbis.
Sure. Thank you, Rob. So I'm Gabriella. I am from Connecticut, and I actually started out at a very small branch school of the University of South Carolina doing chemical engineering. And then when I transferred to UConn, I kind of was more invested in my programming classes than my chemistry classes. And so I kind of changed my major to math, and then I got really involved in the nitty gritty math and actually programming the math behind the algorithms. And I knew that I wanted to be in healthcare, and my mom is a nurse. And so she has been a pediatric and geriatric nurse for the past 43 years. And so all growing up, I was surrounded by her, making sacrifices and helping and just doing everything she could in healthcare. And I wanted to make that impact as well from a different angle. And so I think Orbis brought into my life everything that I wanted out of a career, and a way for me to use my technical skills and the things I love in terms of programming and math and just everything technical into the healthcare space to help people with the greatest need. So when I found Orbis, and it was a run-of-the-mill Indeed, I was about to graduate and I was looking for a job, and this was posted, and I met with Nicholas, who is our other AI team member, and we talked, I think, for 40 minutes after the interview ended, and both of our goals just really aligned. And yeah, I knew that this is where I wanted to be. So that's how I kind of got involved with Orbis, and it's just been uphill ever since.
It's great. It's great. It's really nice to know that there are plenty of programming and AI people who aren't involved in the world of finance, because every single person I seem to know is either finance, programming, AI person. So great. And it's really great to meet you. Sophia, I think a lot of people know you already. You're active, obviously, not just with Orbis, but out in the investment community. And a lot of the OIS audience has already seen you. We'll talk a little bit more about how that role is going to expand towards the end of this podcast. But why don't you give people a little bit of your background and tell people how you ended up here?
Yeah, thanks, Rob. And you're right. We've known each other for some time, but this is the first time we get to do a podcast together. So
that is correct.
I'm thrilled about that. And what better start than with the Orbis team? And as Gabrielle has pointed out, it really is about the people as well. So as you know, I'm an ophthalmologist by training. In the UK, it's a little different. We have to do our kind of ophthalmology surgical training, and then we would go for an attending post. But in between, I wanted to undertake a clinical PhD. And at the time, I submitted my application and I didn't get through into the program. And then it wasn't very trendy to talk about failings or failing or resilience or any of those things. So I didn't know what to do. And it's always boils down in my life to my family and to my mother. My mother had seen a documentary about a plane that goes around the world. And I said, don't be silly. I've heard about the train that has treats for dental conditions, but I don't know anything about a plane. 2 months later, I met Hunter when he was on the way back to the US at a cafe in London. And, like Gabriella, we talked some more. And I just knew that this was something I had to do. And as luck would have it, there was an opening to join the Flying Eye Hospital as a staff ophthalmologist. And that was in 2009. And I can confidently say that was the making of me. I think I went from being pretty kind of semi-confident ophthalmologist, able to handle a clinic, suddenly being thrown into an environment where you were not only responsible for patients, but you were part of a multicultural, multinational team. You had to learn things like belt loading your own luggage onto a plane. You had to serve tea in a galley, but you also had to do all the things that an ophthalmology resident would do. And Hunter taught me one thing. He mentioned the volunteer faculty. It was very clear when I joined that we were kind of the rock stars and the roadies. And so I was very much a roadie, and we'd have these amazing volunteer faculty come as rock stars, but it taught me a lot. And being led by Hunter at the time, who was our medical director on the Flying Eye Hospital, all these things that you don't really learn as a clinician, sort of the concept of servant leadership and leading by example, all of these things, it was like getting a first-hand training by seeing Hunter, do this for a team of many diverse people, not just doctors and nurses, but also biomedical engineers, operations, supply chain. So it just gave me this wonderful grounding, I think, into how to be in time a leader in the space. And that year went too quickly. And then I went off and pursued my PhD, and then took a foray into the corporate biopharma world, and now in venture, as you know. And I feel like it's very nice for me because I kind of come full circle, because just at the end of 2021, I was appointed as a board member to Orbis UK. So that's a wonderful way, I think, for me to pay it forward, but still be very much connected to the organization. So thrilled to be on the podcast with Hunter and Gabriella today.
Great. It's really great. I'm glad to have known, get to have the opportunity to know all of your stories and to, see some of the passion behind, multiple ways that you can get involved here. Clinical, philanthropy, programming, AI. It's pretty fascinating.
The Ophthalmology Innovation Summit is back in a big way with OIS 12 being held at the Hard Rock Hotel in San Diego on December 2nd and 3rd. Get ready for a rocking time networking and having fun while expanding your knowledge and making new connections. For more information on presenting or attending, visit OIS.net today.
Hunter, I think that most people associate Orbis with the Flying Eye Hospital, and this is the 40th year anniversary of the Flying Eye Hospital, which is unbelievable to think about how long, Orbis has been doing that, but it's a much bigger organization than that. So, can you give people a little bit of an overview about what Orbis is? And, you can go through a little bit of the details of the Flying Hospital, but I think we also want to spend a little bit of time, focusing on some of the new initiatives, including Cybersight and the AI initiatives that specifically relate to Gabriella. But can you just let people know who may not be familiar with what Orbis does, give them some of the details?
Yeah, so obviously we took flight in 1982 with the DC-8. And since then, we've really grown as an organization. We have permanent country offices, for example, in Ethiopia, where we've been operating for more than 20 years. Every year, we distribute over $200 million worth of Zithromax to treat glaucoma. So we have over 70 full-time staff in Ethiopia every day focused on glaucoma elimination. Not many people know that. We also have offices, for example, in India, Bangladesh, China, Vietnam, Zambia. So, we have permanent boots on the ground, and that's really the workhorse of our portfolio, where we're doing this work day in and day out, whether that's building a pediatric eye hospital in India, where we've built 33 designated pediatric eye centers. That doesn't mean they have Mickey Mouse on the waiting room wall. That means that they have a pediatric anesthesiologist, a fellowship trained ophthalmologist, a social worker, orthoptist, that whole cadre, because we all know it takes a village to give a child their sight back. So certainly our country programs are a key driving force of our portfolio. But really what I'm excited to talk about today is our technology, whether it's building a simulator or converting the Orbis Blind Eye Hospital into a simulation center, which it's doing right now in Texas with our partner at Alcon, with the doctors from the Ophthalmic Society of the West Indies in the Caribbean, or with Cybersight, where 24/7 we are doing live consults. We've done over 25,000 consults from around the world. And these are not a grandmother asking about their grandchild's glasses. These are a super subspecialist in one country asking a peer in another country for help. So for example, we've had almost 1,000 consults for retinoblastoma alone Most of those are linked to St. Jude with Matt Wilson. So he's one of our volunteer faculty. So I'm really excited to see how we're everywhere now. Cybersight, as I said, is in every country in the world except for 2. And every day we're doing consults, webinars, courses. We have over 7,000 registered users every month taking our courses, but we have over 63,000 registered users on Cybersight. That's a huge community online. And these are all eye health professionals. So doctors, nurses, anesthesiologists, biomedical engineers, technicians. So really we offer training and support to every level of eye care, whether it's teaching a school teacher how to diagnose strabismus or leukocoria in the classroom, or teaching a very high level oncologist how to manage retinoblastoma that's recurrent, or how to follow the family members with a geneticist and things like that. But like I said, I really think what Gabrielle is leading with Cybersight and AI, I sit back and watch their results and it's just breathtaking. Like you sit there and see how accurate these machines are, what they're able to do, and how these are going to be force multipliers. We've always tried to democratize education, and now we're trying to democratize technology so that that kind of access is available no matter where you are in the world. And I'm super proud of what the team has done, especially getting this into peer-reviewed literature.
It's amazing. I think that in the United States in particular, there's this probably, I don't know if I want to call it ignorance or just a lack of need to understand the depth of what Orbis provides, because there are ophthalmologists everywhere here. I think I live on Long Island in New York. I think there are more ophthalmologists in Long Island than there may be in the entire continent of Western Europe. I honestly, I think that's actual real fact. So, I think that there's this general lack of understanding of how challenging it is to provide quality eye care to underserved areas of the world, and how big of a problem it is. I mean, you guys have been at the forefront of discussing the global problem, and there's over 1 billion people on the planet right now with visual loss, right? And there's going to be something like 60 million people who are blind, and a small number of those are here in the United States. And there's a significant proportion of that I imagine is preventable and would have been prevented with accurate care.
Yeah, so about 75% of that could be prevented or treated, and 90% of that is in low to middle income countries. So that's kind of the triple hit, where you're born or you suffer from visual impairment, you're already in a low to middle income country. And also gender is a very important focus for Orbis in our portfolio. We have several papers coming out about the importance of gender, not just in the workforce, but also as a patient and a patient care provider. One of the things that's really cool is you can do cataract surgery, and not only do you give that person their sight back and restore their autonomy, their dignity, but it also gives the caregiver back their life. So really, when you do cataract surgery, you're often giving 2 people back their life or their autonomy, which is really exciting.
Yeah, it's fascinating. Speaking to you, you realize, sort of how myopic we are when it comes to the view of our local problems in eye care. And when you hear these statistics and you realize the depth and scope of what Orbis does and how impactful it is, how much need there is, and I think that Sophia and I sort of have chatted about this in the past, that, one of the motivators for us to pursue at least investment in ophthalmology is to try and find solutions to problems that will have a global impact and hopefully help, not just individual treating physicians, but organizations like yours to provide, better care, down the road. But it's unbelievable when you start to hear about, 1 billion people with, visual impairment and 60 million blind people. It's just incredible. Gabriella, Hunter's been referring a lot to Cybersight and the AI initiatives. Can you give everybody on, who's listening in a little bit of insight into what it is that you guys are currently pursuing with regard to your, Cybersight program and all of the AI work that you're doing?
Definitely. So Cybersight, there's kind of 2 facets to Cybersight. There's the consult side. Consult is the live surgical demonstrations, the remote surgical mentorship, advice from the volunteer faculty, and then the free access to the ophthalmic training courses, the lectures, the quizzes, and that kind of side. And then the other facet is the AI. So the AI is our kind of bread and butter to make sure that nobody is left behind this AI revolution. So Cybersight AI works to really bring the benefit of technology to all patients, regardless of where they live. And again, I think the biggest part of Cybersight is the fact that it's free for low middle income countries. So, a lot of times the issue with AI is that there's no access and there's no real way to bring that technology to these areas. And so with Orbis, where we really aim to bring that technology to these places that don't usually have the access to it. So the AI side is really exciting because in 10 or so seconds, it can detect anomalies associated with common eye diseases. So for example, glaucoma, diabetic retinopathy, macular disease. It also finds optic disc anomalies and macular anomalies, and it does that all in seconds. So it's really exciting in screening cases where, you're taking images of the eye and then, you have shortages in human graders. So when you're screening, you can run these images through the AI, and in seconds, you can get results back that can assist the graders or the clinicians or even, nurses and other people in these clinics, so that there's no delays and missed opportunities in reporting.
So just give me an example, and just so I think I get a better understanding for myself, tell me about the practical application of how you're using this. What is the actual step involved? And Hunter, you can jump in here if you need to, but you have these AI algorithms that I don't know if they're licensed or created at Orbis or however you've developed them. And how are they used? Do you have people with cameras out in the world taking pictures, offering screenings, advertising? What's the practical nature of how somebody can benefit from what you're doing on this technology front?
So I think the simplest way to explain it is you have people in clinics with the cameras. We also, I think Hunter and I tested this out once where I took a picture of a retinal image on my phone and then I uploaded it to the AI and we were able to get results from an image of an image. So basically you just take a picture, you take the fundus image and you run it through the system, and all you need is internet access, which is something we're working on, but currently you just need internet access. And then that's when you get results back. So then the results come in the form of a PDF, you get an email, and it shows you the picture of the eye. And it will also highlight the areas that are in question. So it'll show you the vertical cup to disc ratio. It'll show you any optic disc or macular anomalies. It'll show you hemorrhages and DR. It'll also give you the DR grading scheme, the scale from normal to proliferative. And all of that happens in seconds.
And so I'm assuming that there are places around the world that will be able to have an operator taking a picture of a patient and then running it through the Orbis algorithm, whatever your AI program is, and then getting back some information that says this person has diabetic retinopathy or has, glaucoma, macular degeneration, whatever. And then that person is then referred for treatment, or is that sort of the main purpose of running these programs, is to screen?
Yes, currently, yes. Screening is a big portion because in these low resource environments, a lot of people either have to travel really far to get to the clinics, or there's a lot of missed opportunity in terms of the patients. And so we found in our Rwanda study that using the AI actually resulted in more people following up on their referrals because they were able to get that information and that kind of refer status immediately, as opposed to waiting, up to 3 to 5 days for a human grader to tell them, yes, you need X, Y, and Z, or, you're good to go. I think it's really important to note, though, that the AI is human-centric. So there's always a human involved in the loop. The AI is not meant to replace the clinicians and the people working in the clinics and the eye care professionals. It's meant as a tool. So it's meant to lessen that burden of these human graders and these screening areas in clinics, so that they're not overloaded and there's less missed patients in the system.
Was this developed in-house by Orbis, your protocols?
So we had a partnership with a former company that then donated their algorithms to us. We've continued to work with that algorithm and, certainly have refined it. I think one of the things that's super exciting and it's hard to believe, but more people in the world have access to the internet than clean water. More people have access to bank accounts than clean water. And what Gabriella has done is actually merged AI. So we're not doing machine learning, we're actually doing machine mentoring. So when they submit a consult, they can enable for posterior segment disease, they can enable or turn on the AI and very quickly have all of it highlighted. So that even though we do have human supervision and one of our volunteer faculty follow up within 24 hours, within 10 seconds while the patient's still in the chair, they can go back, oh, I missed that little ditzel, or, oh, that was neovascularization. And it is incredible the accuracy of these algorithms. And, sometimes you see what you're looking for, not what you're looking at. Sometimes the retina teams aren't looking at the optic nerve, and all of a sudden they missed, a 0.7, 0.8 nerve that needed to be referred. And I see you smiling because you're a glaucoma person. I think the other thing that
you
I
saw
love,
that, huh?
yeah. I think the thing I also love is that Gabriella and the team have made it camera agnostic. A lot of times, a lot of these AIs are tethered to the highest, most expensive, most beautiful camera. We're actually having some doctors submit from, their phones the image. Now, obviously, garbage in, garbage out. We have a gradability score before that photo goes through the algorithm. It has to, they look at not only is it the correct eye and is the optic nerve in the macula and frame, but also looks at the crispness of the photo. I think the thing that kind of goes complementary, and I think Gabriella talked on this, we're a training organization. So I believe we have the only course in the world that's free for technicians on how to do a fundus photo. There's not a lot of, training out there on such basic things as how to do a good fundus photo. So a lot of our partners are, taking these courses, the doctors, the residents, but then ultimately the technicians, making sure that we do get quality images in, because that quality is what's critical. As far as where we're applying this, we're doing everything from our randomized clinical trials to our long-term partners, but we have doctors that we've never met who have been part of the e-consult community that are now going gangbusters with AI. And that, to me, that's what's really exciting, where now AI is another, tool in our arsenal for training, and that we've merged consults and AI. We now have AI, working around the globe and also educating the algorithms with data sets. I know everyone's concerned about the digital divide, and the haves and the have-nots are getting, potentially farther and farther apart. The same is true with data. And we've written a thought paper with Dr. Chiku Matenge, who's one of our doctors and medical advisors in Rwanda, where we also have a responsibility to make sure our algorithms have global data, that we're not populating this with blue eyes from the Beaver Dam study or the Blue Mountain study, and all of a sudden it's not applicable to someone in West Africa where they may have a different optic nerve or cup to disc ratio. So I love the fact that we're globalizing our resources and training, but also making sure our data sets are very robust. I believe we have one of the largest glaucoma data sets in the world, and that's partially because of our volunteer faculty member, Dr. Cahook. He also sits as the chair of my medical advisory committee, where he's purposely helping us get data from around the world. So we're not just feeding it all the data from city X or state Y. We're getting data from literally every corner of the world, which just makes our algorithm better and more accurate.
You mean you may actually have a normative database that's made up of people?
Yeah, and so I mean,
lots of people, right?
So Sophia is the PhD. I don't know the difference between mean, median, and mode, and I certainly don't understand big data, except it has a lot of numbers after the decimal point. But I would say that certainly Gabriella has worked with our team to get a global representative data set, so that we don't have biases with geography. And I think that's really exciting to see how we're trying to globalize data. And certainly, that to me, we have a responsibility as a global nonprofit to close the digital as well as the data divide when it comes to AI.
Yeah, I don't think there are very many organizations on the planet that have the ability to do that. I don't think there's probably anybody who has as much exposure to clinical patients, across the planet as you do at this point. I mean, so obviously using that access and creating something that will make technology better is, fundamentally critical, and probably a very honorable way for you to, participate in the development of science. And nobody's just going to have that. Sophia, you're a venture capitalist, you're the trustee. It sounds to me like everything that Orbis is doing is very expensive. So, there's they when we'll talk about some of the where the money comes from and how people help in a couple of minutes, but what are your thoughts as a trustee? Like, what do you, people here, I'm a board trustee and all this stuff. I mean, how do you merge your world of, finance into your fiscal responsibilities to the organization? How do they come together, and what do you think is the reason why that makes sense?
Yeah, great question, Rob. And I'm learning a lot as I've been a trustee now for the last 6 months. And what I've seen is that, we have our UK Board of Trustees, and then of course, Orbis in New York have their own board as well. And we take a lot of learnings and sharings from what they're doing. What I have seen from the Board of Trustees is that it's the diversity in the board that really helps us to think about the strategy and our fiscal responsibilities. So we comprise, of course, me with my kind of medical and venture hat on, other ophthalmologists. We have ambassadors from the US and from the UK, people in business and media. And I think we think very carefully about sources of fundraising, the fiduciary responsibility we have, particularly in the UK, and we have very strict reporting constraints. Many folks listening in the UK will know that some nonprofits have been under intense scrutiny because of the way that they've managed their accounts. So we're very mindful of the role we play as trustees. And I think, we actively look for fundraising at the kind of one-to-one level, and Orbis UK is pretty successful in that element. But I think what we've realized is Orbis UK as well is that we have a great ability to develop strategic partnerships. So one in particular is with the Qatar Development Fund. And we have Her Royal Highness, the Princess of Wessex, Sophie, another Sophie, coming along, who's been to one of the programs, I think, in certainly in Doha, if I'm not mistaken, Bangladesh as well. So I think collectively we understand what we need to be doing as trustees, and we take that role very seriously. But you're right, it's an expensive business, and so we do look to our strategic partnerships, some of which are well established, like the one with Alcon. In fact, when I was a staff ophthalmologist, I remember we had Alcon consumables and capital equipment, and it was just it's how you learn, and it was great to have that exposure early on. So it's great to have that level of corporate social governance, which helps us to achieve our goals. But I think maybe Hunter could speak very well to the kind of evolving strategic partnerships and how we go about fundraising at that kind of bigger, more kind of corporate level.
Yeah, and I think one of the things I've really enjoyed about our portfolio and organization is we have a very balanced funding streams. Both geographically, we do fundraising in the UK, where Sophia sits as a trustee, but in Hong Kong, in Singapore, we fundraise in mainland China, and Beijing and Shanghai. So, one of the things that we're constantly doing is growing not just our footprint, but also our funding and revenue streams. We have funding from government grants like USAID or DFID, from industry, whether it's Alcon or Santen or FedEx or Omega. Foundations, for example, the David and Molly Pyatt Foundation, they exclusively fund our work in Zambia, where every single ophthalmologist has a Cybersight account. And we've done incredibly innovative things with Cybersight, whether it's connected wet labs or real-time surgical mentorship, where literally we have a doctor in Indiana, Dr. Dan Neely, who's a pediatric ophthalmologist, in the OR in his pajamas in Indiana with the doctor he trained and worked with in Mongolia doing her first unassisted trabeculotomy. So he's doing virtual shoulder-to-shoulder mentorship. And then certainly we have individual giving, whether it's a person giving $5 a month. We're especially strong in individual giving in Hong Kong. So you'll see that we have a very broad portfolio clinically, but also from a revenue and a corporate giving. We have incredible supporters, some of which who have been with us even before the plane took off, like Alcon. So, Alcon and FedEx are key members of our corporate partnership, but Santen has come on now, and they're extremely interested in the AI and are helping us build out AI around the world. And that's part of what Gabriella does with the research.
Well, it's unbelievable. I think, as we sort of get to the end of our discussion today, I think, for me, doing a little bit of preparation in advance of these, because it's not just all off the cuff, Sophia. Sometimes I put
Rob, you're a natural,
I put a little work into it, just so you know. And finding how broad the scope of your involvement is in global ophthalmology, it's pretty unbelievable. And in some ways, it's probably more so than most corporations, and maybe every corporation, at least in terms of the breadth of your involvement. And you've managed, for some reason, and maybe it's just me, but I don't think so, to keep a very humble and modest profile while you're out there doing all this incredible work and helping patients with visual impairment and preventable blindness receive treatment, but at the same time contributing not only to the compendium of literature, but also providing, novel access to AI. It's pretty fascinating. And, and just in my interaction with the world of developing technology, I would say that you guys are probably one of the most robust organizations or corporations that probably exists in the world today. I mean, you'd agree with that, Sophia, right? I mean, who else does what Orbis is doing at this point?
Yeah, it's incomparable. That's why I'm so proud to be a trustee as well, because what they're doing is amazing. Yeah.
Hunter, people want to get involved. They want to contribute. They want to volunteer. How do they do that? What's the process?
Yeah, it's a great question. You go to our website, orbis.org, and literally there's a how to join click. One of the things I encourage people, obviously a lot of your audience are clinicians. We have people deploying, and we're restarting our foreign deployment now, but also realize some of our biggest impact players are people who never leave their hospitals. Through Cybersight, we are always looking for volunteers, whether it's volunteer pilots, volunteer nurses, doctors, but, we have a volunteer lawyer who's helped us write informed consent and help draft that for the first time ever for our country. So if you're interested, obviously cash is always welcome, but I think for your audience, I'm mostly interested in their networks, their ideas, giving us candid feedback on the website. Cybersight is a constant build, where my goal is to have that be the go-to source for global medical education by 2025. We know we have gaps, and we would definitely appreciate, so if one of your listeners is a cornea expert, having them contribute with a webinar, a course, a manual, things like that. So I think how to contribute is really up to the individual. What are your gifts and what is your bandwidth? But if you go to orbis.org, you can see every which way that you can join, whether it's with being an international trainer and surgeon, or if it's working with Cybersight, giving lectures, or being a consultant for the telemedicine consult that we run around the world.
So, for anybody who's listening who might be so inclined, there are definite ways to participate that don't involve you getting on the flying eye hospital. And I think that's the biggest message here, that you can contribute in lots of different ways. Probably something that would have helped me to know back in the day, but I think technology is advanced now where that's becoming more of a reality. I can't thank you all enough for speaking with me today. Again, for my own personal education and understanding, how far-reaching Orbis is and how impressive the contributions that you've made to healthcare are. It's been a pleasure to know the people behind the organization to some degree, and to get to learn a little bit about you as well. So Hunter, Gabriella, and Sophia, thank you. For those of you also who don't know, Sophia has been very expertly recruited to take on some podcasting assignments for OIS as well. So look out for Sophia's podcast. She's much more pleasant to listen to than I am. So hopefully you'll enjoy.
Well, we know that's not true.
hopefully Sophia will come back and interview the Orbis team from a different perspective at some time in the near future, as you continue to give us, updates on the development of your new initiatives. And I'm sure that the audience would look forward to hearing that update down the road as well. So again, Hunter Cherwak, Gabriella Lanuette, and Sophia Petit from Orbis International, thank you so much for participating in today's podcast.
Thank you, Rob.
Thank you, Rob.
Thank you so much. Have a great day, everyone.
Thanks for listening, everyone. We hope you've enjoyed this episode of the OIS podcast. Be sure to listen in next week as we discuss the latest innovations in ophthalmology with experts in science, medicine, and industry. Subscribe to our iTunes channel so you don't miss a thing. Got a story of your own to tell? Apply to be a guest at ois.net.